And our next speaker is physician Kok Hsien. He is a registered TCM physician from NTU Chinese Medicine Clinic. His topic is on acupuncture or neuropathy. Please welcome Physician Tan.
Very good afternoon, everyone. First of all, I would like to express my respect to all of the patients here for your determination and fighting spirit to face this illness so bravely. And I can see that there are a group of doctors and caregivers who are here to support all of you through this process. So I believe the outcome of your disease will be good. You need to believe you will get better as well. All right. My name is Kok Hsien. I am a Chinese medicine physician, and I work with NTU Chinese Medicine Clinic. We are very honored to be invited today to come and share some information on Chinese medicine with regard to the treatment or how we can complement the treatment of peripheral neuropathy. All right. The topic of TCM is actually quite broad, and we are happy that the organizer today has given us a clear direction, which is to talk about how acupuncture can complement or help in the treatment of peripheral neuropathy, which I understand is a common side effect of chemotherapy, or especially with the drug called Velcade. All right, so I would like to start off with sharing about two research studies in this field of regarding using acupuncture to relieve or improve peripheral neuropathy. All right, so this first study, this was published in 2017 in the BMC Cancer Scientific Journal. This was conducted by the Myeloma Center at the first affiliated hospital of the School of Medicine in Zhejiang, China. All right, so for this study was actually conducted between the period of 2010 to 2014. During this period of time, their center actually diagnosed and hospitalized 400 over myeloma patients. And among these patients, they hoped to get some participants for this study. So they had some criteria. All right, so they chose patients. First of all, they must be diagnosed with myeloma. And at the point of diagnosis, they do not have any symptoms of neuropathy. And after undergoing chemotherapy, they started to develop neuropathy and at least a grade 2 or above of this neuropathy. Right? After that, they stopped the chemotherapy and they asked this group of people whether you are willing to take part in a new therapy and be included into this study. All right, so some of them agreed and eventually they are included into this research. So they are randomly divided into two groups. One group would just take this medicine called methylcobalamin, which I understand is a form of vitamin B12. All right, so this group would take only methylcobalamin. And the other group, on top of methylcobalamin, they would take it in the same dosage, the same manner as the first group, but on top of that, they would also undergo acupuncture. All right, and then they were actually compared in three of these parameters. One of it is the FACT or GOG score. This is actually a score which investigates the patient's daily activities and the degree of neuropathy. Or in some sense, we can say and understand it as a kind of a quality of life kind of study. They are also measured with this visual analog scale, which is a pain scale to test how painful the patients were feeling. And they were also tested on their nerve conduction, meaning how well the nerves are conducting these electrical pulses. They tested one nerve in the hand, one nerve in the legs. So they were measured on this stuff before the study started and after the study ended. And the results were actually quite encouraging, such that for the FACT GOG scale, the scale which measures their quality of life, this scale showed improvement in the group which underwent acupuncture, and this improvement was not seen in the group which just took methylcobalamin. For the VAS scale, the results showed that there was improvement in both the groups, which is very good, but the improvement is more significant in the group which underwent acupuncture on top of metoclopramide. And for the nerve conduction study, it was also shown to be an improvement in the patients in the acupuncture group and not shown in the patient in the metoclopramide only group. So the conclusion for this study is that acupuncture for chemotherapy-induced peripheral neuropathy as an adjunct kind of therapy leads to significantly improved outcome for patients, meaning it can help patients with this neuropathy. Okay, this second study here, this is published in 2014. This was done by the University of Maryland in USA. For this study, they recruited 27 patients who had peripheral neuropathy of at least grade 2 or higher. And this is despite these patients having adequate medical intervention already and having discontinued or having stopped their chemotherapy already. So these patients also underwent acupuncture, and they were compared in these 4 parameters. They were also, this group of investigators also used this FACT GOG neurotoxicity scale. They used another pain scale called the Neuropathic Pain Scale. They also conducted these nerve conduction studies, and in addition to all these, they also measured a few serum biomarkers, predominantly those dealing with inflammation. Okay, so what they found was that these patients who finished this treatment process, they showed a significant reduction in the score of the FACT GOG and the Neuropathic Pain Scale score. And this suggested that these patients have decreased pain and improved function of their limbs and of their life, although the nerve conduction study and serum biomarkers did not show significant changes. So this is a little bit different from the study which was introduced earlier on. So the conclusion is that acupuncture produces subjective improvements in the patient's symptoms, meaning the patients themselves can feel that they are better. They feel less painful, they feel that their quality of life is better, although the nerve conduction study and some of their serum biomarkers did not show any improvement. So this shows that this improvement in their quality of life and their own feeling might not be due to this nerve conduction improvement or these biomarkers involvement. All right, over here I still have found several more studies with regard to using acupuncture for peripheral neuropathy. Most of them reported positive results, which is very encouraging. For example, if we look at this review paper of some studies done earlier in the 2003 to 2011, some of them reported true acupuncture is better than placebo. Some of them reported improvement, acupuncture better than cobamamide. This study shows that after undergoing acupuncture, there's no more symptoms. This one reported 82% improved. This one reported acupuncture better than control, etc. All right, so most of the study regarding acupuncture for neuropathy at this stage still focus on the efficacy of acupuncture for this problem. Meaning to say, if we use acupuncture to treat this problem, is it useful or not? And not so much on if it is useful, why is it useful? Right, so this is the stage at which acupuncture for peripheral neuropathy is at. But having said that, there are some other scientific effects of acupuncture that has been proven by many people over the years. Some of these more recognized ones are that acupuncture can help to vasodilate or improve blood perfusion. And clinically, this might mean that it can help with the recovery and repair of tissues. It can also release endorphin or encephalin in our body. These are our body's natural painkillers. So in some sense, this is how it helps with pain. Acupuncture have also been shown to improve the availability and utilization of brain nerve growth factors. This probably helps nerves to repair and regenerate. It also produces some pro-inflammatory cytokines, and this helps with reducing inflammation. All right, so although the design of the study that I have shown earlier on, most of them are not identical. That means some of them study acupuncture and they use these several acupuncture points. The other study use different acupuncture points, or this study, they undergo acupuncture every day. The other study, they have another treatment regime. Although the design of the experiment is different, but it just shows a general good direction that acupuncture is effective in improving peripheral neuropathy. And what is most important is that no studies reported any side effects. So this is one of the most important points that we must take note of. All right, so with all this information that we have on hand, this actually gives us some confidence and evidence to employ acupuncture clinically for the management of peripheral neuropathy. So for the next part of the talk, I will talk about acupuncture in the TCM sense, all right, to introduce what acupuncture is about in Chinese medicine. All right, so I have to introduce a few very basic concepts. First of all, we talk about qi and blood in Chinese medicine. What is qi? Qi is something that is, we say, invisible, but is present in our body. It is a vital energy that runs our bodily function. For example, like why our heart can beat, why we can breathe, why our stomach can digest food, etc. It is because of the presence of qi. And the qi is healthy, it's flowing smoothly. That's why our body functions are performing well. Blood, on the other hand, can be visible. Its main function is mainly to act as a source of nutrients to the different organ systems and to nourish the different body parts. And we say qi and blood, they flow in what we call meridians. Meridians are pathways in our body where qi and blood flows along. I would often draw an analogy of a meridian, or in Chinese we say 经络, to like a network of complicated network of roads in a busy city. All right. So another concept that in Chinese medicine which is important is about the organ system. That each organ system has its own sets of functions, and each organ is actually connected to one meridian. So putting all these together, to summarize them, at least for today's understanding, we say that qi and blood flow in meridians, and each meridian is connected to an organ. So by this connection, each organ is connected and can affect each other. All right. So next, let's understand a bit more on what are acupoints. Acupoints are specific points on these meridians that can help to regulate the flow of qi and blood. So going back to the analogy where I said we can think of the meridians like a complicated network of roads. So I would, going back to that analogy, acupoints are like traffic junctions on these roads. Right? Just like traffic junctions on road, they regulate the traffic, right? So acupoints on meridians regulate the flow of qi and blood. And how does all this apply back to this situation of the peripheral neuropathy? These symptoms of peripheral neuropathy, like pain, numbness, or decrease in function, weakness of the four ends of our limbs, all these in the TCM sense, it reflects a weak spleen system. Weak spleen organ system. In TCM theory, the spleen is closely related to our four limbs. And because the peripheral neuropathy mainly affects the four limbs, so we would attribute that to the spleen system. And the spleen system is also in charge, the one that is mainly producing qi and blood in our body. And therefore, with a weak spleen system, there will be a state of deficiency of qi and blood. Chinese, we say 气血 两虚, your qi and blood are both weak. Also, we would also say that it reflects your body's failure to direct qi and blood properly or sufficiently to the four limbs, which we put simply is a poor circulation of qi and blood. All right, so with this understanding, the treatment of Chinese medicine would be to improve the function of the spleen, to build up qi and blood, and to help direct the flow of qi and blood, or to improve the circulation of qi and blood to our four limbs. And we can do that with acupuncture by doing acupuncture on acupoints that are on the spleen meridian, and therefore can regulate the function of the spleen system. We can also do acupuncture on certain specific points which can help to build up qi and blood. We can also do acupuncture directly on the four limbs to help improve the circulation. Right, so having understand all these, having the understanding of how it works, having understanding of current research showing that acupuncture can indeed help with peripheral neuropathy. If we are still thinking, I don't understand about acupuncture, how is it carried out, is it scary, I don't dare to try, I will introduce a little bit more on how is it carried out. All right. So in modern acupuncture, we typically use now sterile, one-time use, disposable stainless steel needles, like the picture shown over here, individually packed. So there is no concern of contamination or disinfection of the needles. The needles are very thin. The diameter are only from 0.18 millimeters to 0.35 millimeters. And over here, I just draw a close comparison to the thickness of a human hair, all right, where the thickest human hair is as thick as, or as thin as our thinnest needle, all right. So it's actually very small, such that even when most of the time when we remove the needle from your body, you cannot find that needle hole at all. Your pores are actually even bigger than the needle diameter. All right, and we will insert these needles into specific acupoints in your body, and typically the needles will be left at these points inside for about 30 minutes. All right, so after we insert the needles, we will try to elicit this feeling of what we call de qi. This de qi feeling is we can be summarized in these four kind of feeling: sore, numbness, fullness, or pain. Or in Chinese, we would say 酸麻胀痛. Right? So it's very occasional that it will feel painful. Most of the time, you feel more of a bit of soreness, numbness, fullness at the area where we put the needles. Okay, in some situation, we might consider adding a little bit of mild electric current through the needles. This is to provide constant stimulation to the acupoints. Right, although acupuncture is best known for pain management probably, but acupuncture is actually indicated for many other conditions as well. On the WHO list of conditions where acupuncture is indicated for, there are 100 over conditions, but here I listed some more common symptoms that are present in cancer patients or cancer patients undergoing treatments. So acupuncture is also very good at mitigating or improving these symptoms shown on the slides here. All right, so for the last part of the sharing, I will introduce a few acupressure points. These acupressure points are commonly used in the studies which I mentioned at the start. So like I mentioned earlier, the different studies uses different acupressure points. But there are some common ones which are used in all these studies, and these are some of the few. Okay, and this first one is called the He Gu point. All right, it is on the back of your palm between the first and second finger. Okay, so if we look at these four pictures over here, this is a simplified way of how we can locate this point. All of you can try to locate this point together with me now. You can use the other hand's thumb. All right, we can see there's this one crease over here, right? So you put this crease onto the edge of the other palm. Okay, put it at the edge of the other palm, like this figure number 1 over here. Okay, and after that, you slowly press down the thumb to the tip of your thumb. So the tip of the fingernail there this is called the Heku point. So 1 point on each hand. If you press down hard enough, you can do a little circular motion massage. The feeling that you should get is that kind of 得气 feeling, which is sore, numb, fullness, or a little bit painful for some. This is the feeling that you will get actually when you go for acupuncture. So not that scary, right? Not exactly painful. And you must get that feeling actually in order for it to be effective. So if you are not getting that feeling, meaning probably you're not finding the point accurately or you're not pressing it correctly. So these points actually we can DIY, we can do it ourselves. Although there are no studies yet to show whether self-massaging of these acupoints can help relief. But well, this is something which we can do in our free time. It's no harm trying. You can reflect to us whether it works or not in helping you relieve your pain. All right, another one is called the 三阴交 point. This one is on the legs, on the inner side of the ankle, about 4 fingers width above the highest point of the inner ankle, and just by the edge of the bone. All right, this one is called 三阴交. If all of you seated now, you can like cross your leg over, just put 4 finger width above the inner highest tip of your ankle, and then just behind the edge of the bone. All right. Again, use your thumb to press hard into it until you feel this 得气 feeling. 1 on each leg, so you can do massage alternately. Okay, this third one is called the 足三里. This one is also on the lower limb. If you put your legs 90 degrees down, like what all of you are in now, we can see that there are these depressions on the knee, right? 2 depressions. So from the outer depression, we put again 4 fingers width downwards, and then by the outer edge of the bone as well. Right, this point is called 足三里. Again, you should get that kind of 得气 feeling. If not, probably the point is not correct, or you're not massaging it properly. Right, this last one is called the 八斜 and 八风. The ones on the hands are called 八斜, the one on the legs called 八风. So they are at the, if you close your palm, fingers all close together, just at the tip of these creases are these points. So similarly for the legs. So if you come to acupuncture for peripheral neuropathy, you can expect that these would be the points probably chosen to help with your condition. So just to let you have a feel and understanding of how acupuncture would be like. Okay, with that is all I have to share today. This is just some information on how to reach us if you would like to find out more about acupuncture. I hope that through this sharing, I have introduced a little bit more perspective into another method of managing peripheral neuropathy. And especially for those of you who are not familiar or have not considered trying acupuncture at all, now you have one more option to help with manage your pain. All right, with that, I thank you and wish all of you good health and good weekend ahead.